Hello medical community. Today we will discuss about the manitoux test. The manitoux test is a standard method of determining whether a person is infected with Mycobacterium tuberculosis. The local skin reactions to tuberculin purified protein injected into the skin is used to assess the individual's sensitivity to tuberculin protein. This is known as PPD. The manitoux test is given to children aged 3 months to 6 months living at high-risk environments, infants and children under 6 age of the high history of residency or prolonged stay. There is a history of TB in a household contact last 5 years. Those who have had close contact with person on TB. Administering the manitoux test. Tuberculin PPD RT23 SSI to T to U 1.5 ml solution were injected. Injected site. The test is usually applied on the middle third of flexor surface of the forearm, as a reaction may be weakened near the wrist of the elbow joint. It's usually applied on the left forearm. Ensure adequate light. Select an area of healthy skin which is free of muscles margin, heavy hair, veins, sores or scars. Only visible dirty skin need to be washed with soap and water. Procedure. Use a 1 ml syringe to aspirate out 0.5 or 0.1 ml of PPD RT23 or 0.1 ml. Injected the PPD intradermally. Remove the needle quickly. Do not massage or use tracer. As well defined bulb of 6 to 10 mm in diameter should be formed in injected correctly. If the bulb is less than 6 mm, repeat the procedure 2.6 cm from the first site. After 48 to 72 hours, read the test results by marking down the transverse diameter of induration. Note arrhythmia by Sokal spell point method. Measures of the largest transverse diameter of induration, they note down in millimeter. Reading the manitoux test. The reaction should be evaluated 48 to 72 hours after the injected. Only the induration which is hardened, the raised formation is measured. Arrhythmia is not included in measurement. Measure the diameter of induration using a plastic flexible. Positive PPD reaction 5 or more millimeter. People with HIV infected close contacts, people who have had TB disease before, people who injected illicit drug with whose HIV state is unknown. 10 or more millimeter. Foreign born person, HIV negative person who inject illicit drug, people who certain medical condition, children younger than 4 years. 15 or more millimeter. People who have no risk factor for tuberculosis, as individual of 15 or more millimeter. A healthy person whose immune system is normal, induration greater than or equal 15 mm is considered a positive skin test. In most cases, people who had a very small reaction or no reaction probably do not have TB. Induration less than 2 mm. False PPD reaction. False PPD reactions. PPD reactions. False positive PPD reaction. Sometimes people who are not infected with Mycobacterium tuberculosis will have a positive reaction to the PPD tuberculin skin test. This is called false positive reaction. Two most common reasons for false positive PPD reactions: infected with non-tuberculin mycobacteria, vaccination with BCG, Bacillus calmette-guerin. However, the reaction is more likely to be truly caused by TB infection in any following are true. The reaction is large, the positive with BCG vaccine. False negative reaction. Some people who have a negative reaction to the tuberculin skin test, even they have TB infection, these called false negative reaction. False negative reaction may be caused injury. Type of reaction: false positive, false negative. Non-tuberculin Mycobacteria BCGs. False negative: injury. Energy: recent TB infection.